Hi, everyone. My name's Laura. I am the retail lead at NanoTess, so I'm happy to be here facilitating this webinar, which is obviously put on for you by NanoTess in collaboration with embecta. And I am excited to be putting on this webinar and to be joined by Dr. Eric Fung, who you will see, I think we're the only two with our cameras on right now, but we're going to be chatting through the issue of biochemical imbalance within skin and wound healing and talking about how catalytic technologies are helping to solve this problem. So a little bit about the objectives of this. This is our plan for our time together. I'll talk about NanoTess and CTM, our proprietary catalytic technology. We'll hear directly from Dr. Fung about his personal experiences using personal practice and clinical experiences using NanoSALV catalytic. He'll share some cases from his practice, some cases that he just is really familiar with and would like to use to speak to the technology itself. We'll have some discussion around how pharmacists and primary care providers can support in managing skin and wound concerns in community, and time for Q&A at the end. But a few housekeeping items is that questions are very welcomed and encouraged. So put your questions in the chat as they arise. We'll get to them either in real time or at the end, depending on what comes in and if it's going to be addressed in future slides. But we really love to keep these interactive, and in the name of keeping them interactive and just opening up the chat, as many of you know, this is geared towards a lot of pharmacists, so I know we have some other clinicians in the room, so you can answer this question from your perspective if you'd like, but what would you say is the best thing about being a pharmacist in 2026? You can pop it in the chat and we can see. My personal background is actually nursing, so there's a number of things I could say about that and about my current role, but usually it's the people. That's my favorite, and if I know Dr. Fung, I know it's probably around the same. But as you pop that in the chat and get to know each other a little bit, I will move on to start sharing. Okay, expanded scope of practice, I see. That's great. I hear that a lot, actually. Enhanced scope of practice. All right. And I think those are our two Alberta pharmacists that are attending. But to share a little bit about our company and our why, we are an Alberta-based social enterprise. We were started with a simple belief, and that is that no one should be left behind when it comes to skin and wound healing, because today healing isn't guaranteed, especially when it comes to wound care. And for many patients, there's real uncertainty around whether they'll actually heal, particularly for at-risk populations or our senior population. So our mission is to remove those barriers and ultimately create confidence in healing outcomes. So most of you are here today after hearing about NanoSALV catalytic. I know some of you already have experience using it and just want to learn a little bit more. But quick intro, NanoSALV catalytic is a Class 2 medical device. It comes in the form of a topically applied gel, as you can see featured on the slide here. What makes it a unique approach to skin and wound care is our proprietary catalytic technology, CTM. So our focus in these next few minutes is to discuss how CTM supports skin and wound healing, to give you a little more context on why NanoSALV catalytic is currently used in many different hospital and community settings across Canada. So you can see on this slide where it's used, and I've highlighted individuals living with skin concerns or wounds who need a different solution, because those are often who pharmacists are chatting with. So to answer the question, what is CTM? We first need to define what is healing. And this slide has a lot on it, and that's purposeful. That's by design, because healing is not a single event. It's actually a coordinated biochemical system. It requires hundreds of signals, over 500 active molecules working in precise sequence, turning on and off at the right time to move through the 4 phases of healing. So for example, VEGF, TGF-beta, the interleukins, all of these things are critical in effective wound care and healing. And so this table really is intended to just highlight how complex that system can be, and that each phase, hemostasis, inflammation, proliferation, remodeling, they all depend on a very specific set of cells and signaling molecules to function properly. So That means when healing stalls, it's often not because nothing is happening. It's actually because this system is biochemically uncoordinated, meaning the right signals aren't present, or they're all present at once, or they're happening at the wrong time, or, that's where many current treatments actually fall short in what we have available to us today. So most standard approaches try to solve this by adding a single component or ingredient. Or think of it like a growth factor or collagen, you add one of those. But healing isn't driven by one molecule, it's driven by a coordinated system. So if we introduce something at the wrong time or in isolation, we're not correcting the imbalance, and we can actually contribute to further biochemical mismatch. So with that in mind, I'm going to pause for a moment and allow you to reflect on this question. And if you'd like, you can pop it in the chat. How often do your patients have one of these risk factors listed on the screen? Yeah, share in the chat, because I know the last webinar I did, it was almost 100% at the time, very high. Obviously, we know that all of these risk factors contribute to local biochemical imbalance in the skin and wound area. And what is biochemical imbalance? It's when that skin or wound healing process that we've chatted about slows down or fails because the underlying biochemical signals are not functioning properly. I see Eric put in, or Dr. Fung put in most of the time. So that is what we're going to talk about today, and that's where the current gap in skin and wound care exists, in that, as I mentioned, most treatments focus on external management, things like dressings, moisture, balance, infection control, and of course, those things are very important for holistic care. In fact, on this slide, I've listed a few crucial factors for skin and wound healing, like addressing root cause, like following best standard of care practices. However, for truly holistic care, we simply must also address the necessary factor of the local biochemical environment of the skin, concern, or wound, which is crucial to drive healing forward. So if this system worked perfectly every time, chronic wounds wouldn't exist. All wounds and skin concerns would follow a normal trajectory and progress to closure. So even something like a small skin tear, as depicted here, should heal along a predictable, uncomplicated path like this. But that's not what we actually see in reality. Instead, we often see a divergence in healing trajectories. So some concerns follow this expected path, but others will stall and begin transitioning towards chronicity. So it's critical to understand, as we wrap our heads around this, is that this doesn't happen late, it starts early. So in at-risk patients, biochemical imbalance can begin very early in the healing of, for example, an inflammatory process like the one featured here. And once that happens, the concern is already being diverted away from a normal healing trajectory. So let's take a closer look at this case of contact dermatitis. You'll see there's risk factors listed for this concern. At the time, this concern was actually already identified as persistent. You can see it had been there for months, and for 2 months it had already been treated with a topical steroid, which is too long to be using a topical steroid in perpetuity. But what we see is that instead of progressing, this skin concern was in a state of biochemical imbalance. The signals needed for repair were no longer effectively driving healing or inflammation modulation. And that's often when the progress slows or stops altogether. So this trajectory is from a real case. The patient, as I mentioned, had already used topical steroids for 2 months without relief. So the gap between what should have happened and what we're actually seeing, which is a skin concern not improving, that difference is what we define as biochemical imbalance. It's that space where the system's no longer functioning as intended, and you're not seeing the outcomes that you would hope to see. So with standard of care alone, we continue to support this skin concern through ongoing root cause management, potentially in the case of dermatitis, that's removing any allergen, and following standard of care practices. So for this one, it would be moisturization, for example, and in some cases, the concern may resolve, but in many cases, it continues to stall or progress slowly. But what you can see on the slide here is that this is our opportunity to integrate an innovative catalytic technology like NanoSALV, where we're not just supporting concerns, we're addressing that underlying local biochemical imbalance. And that allows us to help move the healing back towards its expected trajectory, as you can see here. So what actually happened with this case is it resolved in just 4 days of treatment with NanoSALV catalytic after a 2-month journey of no resolution with topical steroids. So the quality of life and body image benefits of this healing for this patient were incredibly significant. Now, let's show you what happens when we do address biochemical imbalance early. And now we're looking at more of an acute wound. I'm trying to give you both because I know that we're chatting with a lot of pharmacists here and you see the skin concerns as well as the wounds, but this is a common patient profile, right? Over 80 years old, known to have slow healing, a history of recurrent skin tears. So we already know this patient is at high risk for developing a chronic wound. We don't need to do extra testing to know this. So instead of waiting, what was done was intervention was started early. So they combined standard of care with an approach that addressed biochemical imbalance, and this allowed the trajectory of healing for this wound to be shifted before the skin tear ever became chronic. This is the outcome. Full closure in 4 weeks. This was managed at home. There were no prolonged complications. So a key takeaway is that we don't have to wait for concerns to become chronic to intervene. And from what I've seen, this is really where a lot of pharmacists are playing such an important role in skin and wound health, because you are often the first ones who patients go to. And I mean, speaking to Carol and Helena's comments on expanded scope of practice in the chat, you are functioning in wearing many hats these days in a strained healthcare system. So we can use risk factors early to identify patients that are likely to experience this biochemical imbalance and adjust the healing environment from the start. So this is where solutions like CTM, NanoSALV catalytic, come in. NanoSALV catalytic is actually designed to fine-tune copper activity, which restores disrupted biochemical signaling, thereby helping skin concerns and wounds progress through the normal healing process. So instead of, as we chatted about, adding a single component or ingredient, we are supporting the system as a whole. And this approach is rooted in copper biology. I'm often asked how NanoSALV works, and it's really through this fine-tuning of what copper already does. So copper plays a role in every major stage of healing. It's needed for in the inflammation phase, to angiogenesis, to tissue remodeling. So rather than introducing isolated factors, we are leveraging a fundamental biological mechanism. So if you recall that table from earlier, the first one I showed when we talked about what healing is, these are just a few on the right side of the screen here of the bioactive factors involved in healing. And what's important is that many of them, such as VEGF, TGF-beta, are copper dependent. So the key is not just adding copper, it's actually controlling and optimizing how it functions, which is where that fine-tuning language comes in. So that's what our CTM technology does. It's designed to maximize benefit while maintaining biocompatibility, and it combines 3 elements: copper for healing optimization, titanium dioxide helps amplify that activity, and silicone dioxide helps expand surface interaction. So our technology has fine-tuned those copper structures so that together they create a catalytic system that enhances the wound environment by communicating properly with the innate healing processes. I've given you a lot of information. So what this translates to clinically is these 3 I's: modulation of inflammation, broad spectrum antimicrobial protection, and most importantly, and what Eric's going to speak to, is active promotion of healing, all in a really intuitive to use, accessible format of topically applied gel. So to pivot directions slightly, I'm really pleased to introduce Dr. Eric Fung. He is a fellowship-trained plastic and reconstructive surgeon with a special interest in microsurgery and complex wound care. He's involved in education, clinical innovation, and collaborative research aimed at advancing real-world wound management for the individuals in the webinar who are from Alberta. He may be a familiar name already, but Dr. Fung has really been instrumental in helping integrate NanoSALV catalytic into standard of care across Alberta. So we're really pleased to have you here today, Dr. Fung, and I was hoping that you could start by sharing a little bit about your current practice area as well as your background and how long you've been using NanoSALV catalytic and also your initial experiences with it.
Sure. Thanks, Laura, and hi, everyone. I did my residency and fellowships in Alberta, and then I started my practice here in Edmonton at Radius Community Health. And what we do there is we look after vulnerable and unhoused populations. That's our sole practice. So that's been it's been wonderful to have NanoSALV. As it is helping people in these kind of austere situations where they may or may not be coming in for regular follow-ups and dressing change. And even if they are having extended periods of time between changes, I'm pretty confident that those wounds are staying relatively clean. In terms of how long I've been using NanoSALV, it's about 2 years now. And I think on the next slide, we have an image that really turned me on and be interested into the technology. So there was a study done by AHS. There was an independent study back in 2023. And when I first met the company, they had sent this information and I was looking through it. Being a plastic surgeon, I was really interested in the photos. So in this study, they had patients who had wounds that were open for more than 1.5 years on average. And they took kind of the worst venous leg ulcers, diabetic foot ulcers, and pressure injuries. And these were things that we deal with as plastic surgeons all the time. This one really stood out to me. And what you see here is in the first week, they start on the study protocol, which usually when you get regular follow-ups, things tend to improve. With Aquacel AG, the wound closed about 45%, which is great. And then in the second month, they started applying the NanoSALV, just a thin layer, and then using Aquacel plain on top. And then the wound healed in 3 weeks, which is wonderful too. But one of the key problems with this kind of injury is that it's not that it doesn't heal, it's that they constantly break open. And you can see that in the first week up top, in between week 3 and week 4, where there's a linear wound, and then that widens between that week. And this person's been in compression, it's under a dressing, it's not that something bad or trauma happened to it, it's just that tissue that it has healed and covered is just not very resilient. And then when you look to the bottom 2 images on the right, on week 3 and week 4, I noticed something very different that stood out. And a lot of people think the pink skin that is surrounding the wound is healthy. And that's true, it's closed, but you can tell that's actually the really thin, fragile tissue that tends to open up and cause a new wound. And then what caught my eye was in the middle, there's discoloration. You think that's odd, but really that's the same color as the rest of the leg that did not have a wound. And then based on the way that the light is shining, you see the corrugations and the thickness that has built up in the middle. And this is very opposite to what we would expect, because normally that middle part had less time to heal. That should be more fragile. There should be less collagen there. And then the outer rim should actually be thicker and healthier. So that really piqued my interest. But then it still took some time for me to really incorporate it into my practice, because it still seemed too good to be true. So if you flip to the next slide. So this is a patient, not a patient, but a friend in the operating room who had a fall on a weekend. And then she calls me the next day, if you see the next. And it's a little inflamed, a little bit red. You have that slough developing, very normal. So this is something that I'm sure you guys will see. They might not be speaking to you directly, but if you catch someone with this, honestly, NanoSALV is a game changer for these skin abrasions that we'll see a lot in the summer. What you notice in the wound is there's that inflammation that is happening from day 1 to day 2, and then that slough developing. All I asked her to do was take a shower, put a very thin layer on top, slap a Band-Aid on it, and then because she's in the operating room, she has to stay relatively clean, so just shower every other day. But as long as that Band-Aid's intact and it's not getting drenched, you can keep that on, and the catalyst will keep working. And so in the next image, that's day 3, 2 days later, she sends me an image, and you can see a lot of that inflammation, especially on the right side of the image, the right image, it has calmed down in the surrounding skin. And then 2 more days later, a lot of the wound has already closed and contracted. The other thing you notice is there's no scab development and there's no ring of red around the wound. It's not that the NanoSALV catalytic is suppressing inflammation. It's just that it's not overexpressing it. You don't need that much inflammation to heal the wound. It's just everything's coordinated and you don't see that ring of red when when the catalyst is in place for the entire time that things are healing. And then in the next set, you can see are fully healed. And I'm just gonna switch over here. Can everyone see my slides? Okay. So the next one, this is a woman who had a burn after opening a radiator cap that exploded. What you'll notice is there's a little blister. So this is a mix of a 1st degree, 2nd degree superficial burn. And what's really cool about the technology is normally the crystals, they don't pass through the skin, but when there's a blister like that, the adhesions between the skin cells have opened up a bit. So things can leak out and things can leak in. And when you put it right on at the time of injury, you get absorption of that fluid and then that blister just settling down and then reabsorbing and reattaching. Normally in our practice in plastic surgery, when we see these burns, we always deroof them and then we try to get rid of the inflammatory mediators that is stuck within that fluid that causes incremental injury if you leave that in place. But in this case, we can keep it clean, just put it on top and then let that seal back down. The only caveat is if it's been 2 or 3 days, that fluid becomes more gel-like and then it makes it harder for things to reabsorb. So the earlier you use it from the time of injury, the better it is. The same for the wound healing phases. The inflammatory phase peaks at day 3. If you can intervene on day 1, then it doesn't have such a high peak. It doesn't cause as much non-specific damage from your body's response to the injury, and there's less to repair and everything speeds along. The other thing I would highlight here is this type of injury, the 1st degree burn, very similar to sunburns. So it's this technology is very helpful for individuals this summer that you might be coming in with moderate to severe sunburns. You put it on, they'll feel the warmth come down, and then I would just have them reapply it with some moisturizer on top 2 to 3 times a day. And that tends to help that heal very, very quickly. Now we've just passed the winter, but this has been kind of a game changer for us here in Edmonton. We had some really cold days. This individual, she has dementia. She was in a long-term care facility, was lost outside for about 4 or 5 hours. And she came back in after rewarming. You can see there's some hemorrhagic blistering happening at the fingertips. Now, the long-term care facility had already been integrating NanoSALV and didn't have any consultation. They just started using it on her, which was great. And those hemorrhagic blisters, which normally take a very long time to reabsorb and heal, actually within a week have calmed down. The other interesting thing that you can see here is they only put it to the tips of the fingers without consultation. In my practice, I would apply it to any area that it has kind of this swelling or erythema happening from the reperfusion injury. But in this case, they just applied it to the tips, and what you can tell on day 16, it's already healed on the fingertips, but lower down, more proximal, where that should have actually healed sooner, where there's better blood flow and less injury, that's taking a bit longer. So you can see that dichotomy in this case. This is an individual. You might be asking, like, okay, great, it works for skin. It doesn't work for anything else. Turns out There's copper-dependent healing in bone, tendon, and nerve as well. So in this case, there's exposed bone that we've cut off and excised due to a subungual melanoma. Normally, we cut thumb off at the joint, or the digit off at the joint. But because it's his thumb, it's his dominant hand, we try to maintain as much length as possible for his function. Now, without NanoSALV, we would never do this approach. Normally, we would take the skin from the bottom, try to refit over the top, leave him with a deformity, or try to transfer skin from the other finger. But because we had the technology, we were able to encourage that bone to granulate in and fill in within 2 weeks. So that bone, which was very, very thin, ended up covering itself up. And then I wouldn't have to worry about it drying out or getting infected and then having to remove it at a later time. At this point, after 2 weeks, I'm very happy with the result. He's gone home just doing the dressing changes himself. And as you can see in the last picture, he's literally sending me photos from his kitchen where he's doing just a daily change. He still worked as a truck driver every day, got on with his life. And the really cool thing about the technology is because it's a catalyst, our body is somewhat programmed to have a function and a form. And what you can see here is there's a little bit of delay in the healing on the radial aspect. And that's because the ulnar aspect was healing a bit faster. But in the end, instead of just closing off and giving him a flat thumb, it remodeled and created something that is much more functional with more padding at the tip and rounded. A much better result than if we had tried some sort of revisionary surgery. Some other useful things that people would be coming to the pharmacy for is some of these moisture-associated skin damage or excoriations in intertrigal regions. I know it's a little embarrassing. Some people in the hospital, we throw on nystatin powder just to dry it up, even though most of the time there isn't a yeast infection. Now, this has been a game changer for us in the hospital as well as in the clinic, where instead of trying to throw this yeast, this desiccant on someone, we just put a very thin layer of NanoSALV on the wound or where it's excoriated, and then I let it dry a little bit, and then put an absorbent pad. That can be just a feminine pad if you're in the community, or just an abdominal pad, just to separate the skin. And the earlier you get to it, the better it is. So this works for older individuals. It also works great for diaper rash, which a lot of family members have told me about. Now, in terms of the antimicrobial effects, I just want to speak about kind of the special use cases. Because in shingles, because the virus is replicating on the surface of the skin, the catalyst has a very good opportunity to reach those viruses as they are replicating and then folding. And the pain that happens with shingles is because it's in the nerves, as well as the fact that it causes a lot of inflammation. And so even though you're kind of addressing multiple things at once, so you're calming down the inflammation with the NanoSALV, and then you're also disrupting the replication. Now, I would still recommend having systemic antivirals for shingles, but it does help a lot with the discomfort and then the resolution of the lesions. And again, the antimicrobial effects of NanoSALV was studied by the Department of Defense. This was how I was introduced to it. And they've tested it on highly resistant strains of Pseudomonas, E. coli, MRSA, and then normal skin infection or skin pathogens, as well as fungal pathogens and some viruses. The cool thing about it is when I use it for my patients in the vulnerable and unhoused populations, a lot of them are colonized with MRSA. And when they get a cellulitis, I apply it not only to the wound, but also to the surrounding cellulitic skin. So as that skin expands and becomes leaky and starts weeping, the same thing as the blister, some of those crystals will come in, it'll calm down that inflammation as the systemic antibiotics are working. And then I think of it as kind of like a sandwich effect, where the antibiotics are flowing within the blood and then treating whatever that can reach. And then at the surface where there might be more slough and eschar, that there's not a lot of contact or kind of availability of the antibiotic, the NanoSALV will take care of things. Now, I wanted to share some of my other colleagues' cases. So it's not just me who's very excited about the technology. Dr. Wong is the now burn director of the University of Alberta Burn Center. And he was consulted on a 98-year-old female who had a fall, that really bad skin tear where you can see there's exposed superficial vein and very, very thin skin. And this skin that's lifted off and kind of a little flap, that's totally devitalized, and we know that's going to die. If we try to pull that over and suture it, we'll have a hard time. It'll probably tear. And then most of the time, we have a hard time making it stick down, staying in place, and taking like a skin graft. So usually this whole thing will develop into this kind of dry chronic wound. But with the NanoSALV technology, if you apply it really early on, what's really cool about it is it helps fill in that tissue gap. So here we see there's a big divot, and very rapidly the tissue will fill in, but not overfill, won't hypergranulate. And then it reaches just to the surface so that the epithelial cells of the skin can start migrating over and covering that wound. And here you're seeing the dual effect where I was showing you that skin flap that was pretty much devitalized. The catalyst, because it helps with extracellular remodeling, extracellular matrix remodeling, it is helping the body, which has signaled that this is unhealthy, unneeded skin, to break down and fall off on its own. So she healed completely and was very happy after about a month and a bit. In terms of surgical wounds, where you'd have really difficult wounds to heal, this woman, she was 75 years old. She was an MVC, had a complicated fracture with exposed bone and then exposed hardware after the repair. She needed a free flap for coverage, so we took that tissue from the side of her leg. Now, the tissue here tends to be quite swollen, and then we have to go back, lift it up, and try to thin it down so she can get into normal footwear. And as plastic surgeons, I mean, we're not perfect, and some of that tissue at the tip ended up failing and dying, leaving her with quite a large wound in her lower leg that had been open for 2 years. And you might think, well, why don't you just throw a skin graft on it? Well, that tissue that we lifted up and cleaned off did not have enough blood supply for its own skin that was already attached. So trying to put a skin graft on it would not likely be very successful. And by using the NanoSALV, it was actually only 80 days that this took to heal. So from a 2-year open wound and then initiating the NanoSALV, we were able to cover it with very healthy, resilient skin, where putting footwear and socks on isn't going to break this down. So this is something exciting that we did over the last year. We actually reviewed all of Dr. Wong's patients over the course of about a year. What we found was we had used it on 89 or 90 so patients. We tried to trim it down to just the lower limb patients, so that was about 43 patients. And what's interesting is most of them had wounds open for more than 7 months. And a lot of them had complications like diabetes, hypertension, peripheral vascular disease, and heart disease. Now, this is us being vulnerable. The blue line actually shows what happens when a chronic wound gets admitted to a plastic surgery service. And what the line is above 0 because the first time we see it, we turn it into an acute wound and we actually make it a bit bigger. And then even with our best dressings, wound vacs, everything like that, in 12 weeks of starting us following these patients, they tend not to change that much. So the slope was like 0.008, basically no change in the first 12 weeks of our care. Once we integrated the catalytic treatment matrix and then doing the exact same kind of dressings, people started healing about 10% per week. And this is very much in line with what was seen with the HS study as well. And so this was just an independent review of our cases. In terms of more, some more of my cases, this is a patient from Radius Community Health. He's had previous burn injuries all over his body, so he has very thin skin. This wound over his knee was open for a year and a half. And just by starting the catalyst, when I started work there 2 months ago, that's how much it's closed. And at this point, it's nearly closed and it's not opening up anymore. And that's the exciting part for me, is that he's still very active. He's still kind of getting into trouble on his own. But in this area, it's not tearing open and making that wound into a complicated chronic wound. And then lower down in his leg, he had a couple other wounds that again had been open for about a year and a half. And all I added to his care was a little bit of cleaning up, like scraping off the slough, and then adding the NanoSALV, putting on a dressing and making sure that stayed intact. And then I just see him every 3 days, and it's actively closing in front of my eyes. So I've been very, very grateful to have the technology to use for these patients. In terms of some more complicated or complex cases, which you might not necessarily see outside of the hospital, this was someone with necrotizing fasciitis, large skin loss, very deep corrugations into between the muscle, exposed tendon, and bone. And we put this plastic on top, which is got a little bit of foam and then like a smooth layer on top. This is called BTM, and the body grows into it, dissolves the plastic. The problem with it is because it's literally just plastic, it often gets colonized, and it takes a long time for the body to actually fill in. So I put the Dr. Wong and we actually put the NanoSALV right on the wound before we put that BTM down, and then that helps incorporate and grow the body granulate into it, and then it also keeps it relatively clean, so we don't have to be scraping out some of the pus once it gets colonized. And then for those who are familiar with skin grafts at an early stage, this is just 4 days, and it's very, very mature. And you can see in between some of the mesh folds that skin has already started to migrate to fill in. So normally at this stage, it still kind of looks like it wants to peel off as a sheet, but here you can rub your hand against it and it feels very smooth. We also put it on the donor site, which is essentially a large area of rug burn or really bad road rash. And that tends to help a lot with the pain, as well as the epithelialization and closure of those areas. And in terms of inflammatory conditions, this is toxic epidermal necrolysis, a idiopathic reaction to taking medications. I'm sure as pharmacists, you're probably quite aware. Unfortunately for her, she's 3 weeks into care in the ICU on cyclosporin and high-dose steroids and just not healing. And one of the problems she was having was with the dressing changes, a lot of bleeding. So she needed transfusions, which normally is not the case for this disease pattern. And so the cool thing about the technology is you can put it under on the wound, it calms down that inflammation and ends up kind of coordinating the healing, but also as long as I can leave that intact, it's not getting drenched, and it's not getting rubbed off, it'll keep working. So instead of doing the dressing changes every 2 days, I had it every 4 days. And because of that she was able to get off of the sedation, and then by day 8, she's fully awake for the dressing change. And that way we could actually get her out of the ICU and then onto the floor and extubate her. So that was a very exciting case for her. And just out of interest, I do help
I
the
told
zoo
Dr.
out.
Fung to not share this.
Yeah. And then she was having some difficulties with ascites and not sleeping and ended up with a blowout in one of her nails. I actually just went to visit her today, but we've been using NanoSALV on the cuticle to help that tissue heal. So that's where the nail is coming out and making that a lot healthier. She also has some pressure sores that you're not seeing here. And she actually just developed some new ones again. And the team was very excited to have the NanoSALV on hand because they could see that actively close before their eyes. The thing I do want to mention is elephants heal super slow. And I do cycle the NanoSALV after about 2-3 months. If I'm seeing no kind of a slowdown of the healing progression, I'll stop it for about a week and then restart it again. And then that tends to reboot the healing, kind of the rapid healing that I normally see with the NanoSALV. And then again, it works on elephants. We've actually healed a little wild bear cub, a coyote, multiple dogs, same biology, which I was grateful to learn from the zoo about. So, but that's all my cases.
Thank you so much, Dr. Fung, for sharing. Thanks for giving us an extra few minutes over the hour. Take care, everyone.